Okay. Hi, my name is Bree. I'm going to be your student nurse today. Is it okay if I do a head to chest assessment? It'll take 10 to 15 minutes.
Yes.
Thank you. Can you tell me your name and date of birth?
Jennifer Strickland, 425-89.
It is concurrent with her wristband. Do you have any allergies?
No.
I'm going to pull the curtain for privacy. I'm going to then perform hand hygiene, put on gloves. I'm going to disinfect my equipment, which I have a stethoscope and a pen light. I'm going to then discard the disinfectant wipe and gloves. I'm going to perform hand hygiene. I'm going to ask the patient, I'm going to move the bed to a working level. I'm going to ask the patient, are you in any pain?
Yes.
On a scale of 0 to 10, 10 being the absolute worst, what could you rate it?
A 6.
Does anything make that pain better or worse?
No.
Can you tell me, describe the pain for me? Is it throbbing, aching, or stabbing?
It's a throbbing.
Okay. Does the pain stay in one location or does it travel anywhere?
Same location.
And is the patient pain constant or does it come and go?
Constant.
Okay, then we're gonna move on to vital signs. Vital signs are within normal limits. Patient appears not to be in any distress at this time. I'm going to then check for her facial expression is pleasant, no grimacing noted. Her mood is concurrent with situation but pleasant. Her speech is clear and not slurred or hard to understand. The patient is alert. Can you tell me your name?
Jennifer.
What day it is?
Sunday.
Where you are?
Hospital.
And why you're here?
Chest pain.
Patient is A&O times 4. Next we're going to, she does not use any assist devices, no hearing aids present. Next we're going to look at, I'm going to perform hand hygiene. I'm going to inspect her skin and nails. Patient's skin is dry and intact, no lesions or wounds present. We're going to now palpate, I'm going to use the back of my hand to palpate for temperature. Skin is warm to touch. Next we're going to touch for skin turgor. I'm just going to pinch the top of your hand. No tinting noted. I'm going to next look at her nails. She does have acrylic nails, but there's enough that I can see that the nail bed is pink. It is smooth and round. They're not dirty, they're clean. I'm gonna flip her hand over and check for capillary refill. Capillary refill is within 3 seconds. Next, I'm going to perform hand hygiene again. I'm going to put on gloves. Patient's face is symmetric. There is no facial drooping noted. I'm going to check a couple things with that. Can you puff out your cheeks, smile, frown? Very all symmetric movement. I'm going to use my hands. I'm going to palpate the top of your head to check for any infestations or lesions. No infestations or lesions noted. Next, I'm going to check the trachea for midline. Trachea is midline, no deviations. Next, I'm going to go to the eyes. The eyes do not have, the exterior ocular structures are not draining, red, or swelling. I'm going to look at the conjunctiva. It is pink and moist. Sclera is moist. Next, I'm going to check on her ears, her exterior auditory structure, medius, for any redness, drainage, or swelling. And I'm going to palpate your medius. Is there any tenderness or pain when I palpate? Okay, I'm going to have you sit up for me. We're going to do the whisper test. I'm just going to have you hold one ear, and we're going to check both ears to make sure that you understand what I'm saying. ABC.
ABC.
I'm going to check the other side.
ABC.
Patient is not hard of hearing. She understood exactly what I was saying. You can go ahead and lay back. Next, I'm going to check for your nose. Nose is, there's no redness, swelling, or drainage noted. We're going to check patency. I'm going to have you hold one side, sniff, and then hold the other side and sniff. Patency is bilateral. There's patency bilaterally. Next, we're going to go to the mouth. I'm going to have you smile very big so I can see your gums. Gums are pink and moist. Lips are pink and moist. Stick out your tongue, please. Tongue is pink and moist. Next, I'm going to take off my gloves. I'm going to perform hand hygiene. I'm going to, put on a new set of gloves to inspect respiratory system. At this time, patient does not appear to be using any accessory muscles. At this time, I'm going to have you sit up so that I can listen to both sides of your lungs, anterior and posteriorly. Right upper lobe, left upper lobe, right middle lobe, left upper lobe, right middle or right lower lobe, left lower lobe. Make sure you breathe correctly or just normally. Right upper lobe, left upper lobe, right middle lobe, left upper lobe, right lower lobe, left lower lobe. No crackling noted. Breathing is smooth and she is not having a hard time. It's not labor. Next, we're going to check your cardiac. I'm going to first take off my gloves and perform hand hygiene and apply a new set of gloves. At this time, I'm going to listen to the different points of landmarks for the heart. Are you comfortable still?
Yes.
Oh, okay. I'm going to check carotid, making sure I do one side at a time. Left carotid present. Right carotid present. Next, I'm going to listen to her heart. I'm going to use the diaphragm of the stethoscope for this one. Aortic is the second intercostal space, right side of the sternal border. Pulmonic is the left side, second intercostal space of the sternal border. Erb's point, that's the third intercostal space, left side of the sternal border. Tympanic is the left side of the sternal border, fourth intercostal space. Mitral valve is the left side of the sternal border, fifth intercostal space, mid-clavicular line. And then we're going to use the apical pulse. Next, I'm going to switch and use the bell of the stethoscope. Aortic, pulmonic, Erb's point, tympanic, and mitral. Next, I'm going to check her radial pulse on both sides, left and right. Pulse is present on the left side. Pulse is present on the right side. Next, I'm going to take off my gloves, perform hand hygiene. Do you have any questions at this time?
No.
Are you in any pain still?
No.
I'm going to, at this time, lower the bed to the lowest level, pull up side rails, make sure bed is locked. Call light is in position where she can reach, and I'm going to then apply gloves, disinfect the equipment that was used, my stethoscope and my pen light. I'm going to discard that, and if there's no more concerns or questions, I'm going to leave.
No.
Thank you for your time.